Diabetes and Fruit, a comprehensive, evidence-based guide to blood sugar management. Medical disclaimer. This article is provided for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment. Diabetes management is highly individualized and depends on factors such as type of diabetes, medication regimen, kidney function, cardiovascular health, activity level, and metabolic response. Always consult a licensed healthcare provider, registered dietitian, or certified diabetes care and education specialist, CDCES, before making dietary changes, especially if you are taking insulin, sulfonylureas, SGLT2 inhibitors, GLP-1 receptor agonists, or other glucose-lowering medications. Dietary modifications without professional guidance can lead to hypoglycemia, hyperglycemia, or nutrient imbalances. 1. Introduction. Beyond the clickbait headline. The Korean headline. 당뇨 잡으려면 이 과일은 무조건 드세요. 피해야 할 과일 4가지 vs 꼭 먹어야 할 과일 5가지. Translates to manage diabetes, you must eat this fruit. 4 fruits to avoid versus 5 fruits you should definitely eat. Headlines like this are common in digital wellness spaces, but they often oversimplify a complex metabolic reality. Fruit is not a medicine, nor is it a poison. It is a whole food source of carbohydrates, fiber, vitamins, minerals, and phytonutrients that, when consumed mindfully, can absolutely support glycemic control, cardiovascular health, and long-term metabolic resilience. The core question is not whether people with diabetes should eat fruit, but rather, which fruits, in what amounts, at what times, and paired with what other foods. This guide will dismantle the myth that fruit must be eliminated in diabetes, explain the physiological mechanisms behind blood sugar responses, detail 4 fruits that require caution or portion limitation, highlight 5 fruits that consistently demonstrate favorable glycemic and metabolic profiles, and provide actionable, science-backed strategies for integrating fruit into a diabetes-friendly eating pattern. This is not a prescription. It is a framework. Blood sugar management is deeply personal, and the most effective approach combines evidence-based nutrition, consistent monitoring, physical activity, stress regulation, sleep optimization, and professional medical oversight. Let us begin by understanding how diabetes works at the metabolic level, why carbohydrates matter, and how fruit fits into the larger picture of glycemic control. 2. The science of diabetes, how blood sugar regulation works. To understand how fruit impacts diabetes, we must first understand what diabetes is and how the body normally regulates blood glucose. 2.1. Normal glucose. Homeostasis. After eating, carbohydrates are broken down into glucose, which enters the bloodstream. In response to rising blood glucose, the pancreas releases insulin. Insulin acts as a key, unlocking cells, especially muscle, liver, and fat cells, to absorb glucose for energy or storage. Excess glucose is stored in the liver and muscles as glycogen, and when glycogen stores are full, it is converted to fat. The hormone glucagon, released when blood sugar drops, signals the liver to break down glycogen back into glucose, maintaining a stable baseline. This feedback loop keeps fasting blood glucose typically between 70-99 mdl, 3.9-5.5 mol/L, and postprandial, after meal. Levels below 140 mdl, 7.8 mol/L in healthy individuals. 2.2 Type 1 diabetes. In type 1 diabetes, the immune system mistakenly destroys insulin-producing beta cells in the pancreas. The result is absolute insulin deficiency. People with type 1 diabetes must exogenously administer insulin to survive and manage blood glucose. Carbohydrate intake directly dictates insulin dosing, making consistent carb counting and glycemic awareness essential. 2.3 Type 2. Diabetes type 2 diabetes is characterized by insulin resistance and progressive beta cell dysfunction. Initially, the pancreas compensates by producing more insulin, but over time, cells become less responsive and insulin production declines. Contributing factors include genetics, visceral adiposity, chronic inflammation, sedentary behavior, poor sleep, and dietary patterns high in refined carbohydrates and ultra-processed foods. Unlike type 1, type 2 diabetes can often be managed or even partially reversed through weight management, physical activity, dietary modification, and medication. 2.4. Prediabetes and metabolic syndrome. Prediabetes refers to blood glucose levels above normal but below the diagnostic threshold for diabetes. Fasting, 100 to 125 mg/dl. HbA1c, 5.7 to 6.4%. It is a warning sign that insulin resistance is developing. Metabolic syndrome includes a cluster of conditions: elevated blood pressure, high triglycerides, low HDL cholesterol, abdominal obesity, and impaired fasting glucose. Fruit consumption, when part of a whole food, fiber-rich diet, has consistently been associated with reduced risk of progression from prediabetes to type 2 diabetes. 2.5. The role of carbohydrates in diabetes. Management carbohydrates are the macronutrient that most directly affects blood glucose. However, not all carbohydrates are equal. The body responds differently to simple sugars, glucose, fructose, sucrose, absorbed rapidly. Complex carbohydrates, starches, digested more slowly. Dietary fiber, soluble and insoluble, which slows gastric emptying, blunts glucose, spikes, and feeds beneficial gut microbiota. The glycemic impact of a food depends on its chemical structure, processing level, fiber content, fat and protein content, acidity, and individual metabolic response. This is why whole fruit behaves very differently from fruit juice, dried fruit, or fruit-flavored snacks. 3. Why fruits matter in a diabetic diet. Despite decades of carbohydrate fear-mongering, major health organizations, including the American Diabetes Association, ADA, the European Association for the Study of Diabetes, EASD, Diabetes Canada, and the World Health Organization, WHO, explicitly state that people with diabetes can and should eat fruit. Whole fruits are nutrient-dense, low in energy density, rich in antioxidants, and associated with reduced risk of cardiovascular disease, certain cancers, and all-cause mortality. 3.1 Nutritional composition of whole fruit. A typical serving of fresh fruit contains water, 75–90%, promotes satiety and hydration. Carbohydrates, 10 to 25 grams per serving, primarily natural sugars, fructose, glucose, sucrose, and fiber. Dietary fiber, 2 to 6 grams per serving. Soluble fiber, pectin, gums, forms a gel in the gut, slowing carbohydrate absorption. Insoluble fiber adds bulk and supports bowel health. Vitamins. Vitamin C, folate, vitamin A, as carotenoids, vitamin K. Minerals. Potassium, magnesium, manganese, copper. Phytonutrients. Flavonoids, anthocyanins, quercetin, ellagic. Acid resveratrol, which exhibit anti-inflammatory, antioxidant, and endothelial protective properties. 3.2. The fructose misconception. Fructose has been unfairly demonized due to its presence in high fructose corn syrup, HFCS, and sugary beverages. However, fructose in whole fruit is metabolically distinct. In HFCS, or table sugar, fructose is consumed in large, isolated doses without fiber, protein, or fat, leading to rapid hepatic metabolism, de novo lipogenesis, and insulin resistance. In whole fruit, fructose is bound to cellular structures, delivered with fiber and water, and consumed in moderate amounts. The liver processes it gradually, and the overall glycemic load remains low. Multiple cohort studies show that higher whole fruit intake is associated with lower risk of type 2 diabetes, while higher fruit juice and sugar-sweetened beverage intake is associated with higher risk. 3.3. Fruit and cardiovascular health in diabetes. Cardiovascular disease is the leading cause of morbidity and mortality in people with diabetes. Diets. Rich in whole fruits improve endothelial function, reduce oxidative stress, lower blood pressure, improve lipid profiles, and reduce systemic inflammation. Potassium in fruit helps regulate blood pressure. Flavonoids improve arterial elasticity, and fiber binds to cholesterol in the gut, promoting excretion. 3.4. Gut microbiome and metabolic health. Emerging research highlights the role of the gut microbiome in insulin sensitivity and glucose metabolism. The polyphenols and fermentable fibers in fruit act as prebiotics, feeding beneficial bacteria like bifidobacterium and lactobacillus. These microbes produce short-chain fatty acids, SCFAs, such as butyrate, acetate, and propionate, which enhance gut barrier integrity, reduce inflammation, and improve insulin signaling. 3.5. Satiety, weight management, and long-term adherence. Fruit is naturally low in calorie density, but high in volume and water content, making it highly satiating. Replacing ultra-processed snacks with whole fruit can reduce overall caloric intake, support healthy weight management, and improve dietary adherence. Weight loss of 5 to 10% body weight can significantly improve insulin sensitivity, reduce hepatic fat, and lower HbA1c in type 2 diabetes. 4. Key concepts. Glycemic index, glycemic load, fiber, and food matrix. To evaluate how fruits affect blood sugar, we must understand several foundational nutritional concepts. 4.1. Glycemic index. GI ranks carbohydrate-containing foods on a scale of 0 to 100 based on how quickly they raise blood glucose compared to pure glucose. GI is 100. Foods are categorized as low, GI, 55, medium, GI, 56, 69, high GI, 70. Limitations of GI. GI is measured in isolation using standardized portions containing 50 g of available carbohydrates. It does not account for typical serving sizes, food combinations, cooking methods, or individual metabolic differences. A food with a high GI may have a low glycemic impact if eaten in small portions or with fat,